Hello students. Today we are going to discuss about the mandibular nerve and its branches. So mandibular nerve is the largest of the three divisions of trigeminal nerve. It is a mixed nerve consisting of both sensory and as well as motor fibers. It is a nerve of the first pharyngeal arch, first branchial arch, and hence it supplies all the structures derived from this arch. Example, muscles of mastication. Then coming to the branches of the mandibular nerve. So branches of the mandibular nerve. So the actually from where does this mandibular division has come is the trigeminal ganglion, which is present in the cavum trigeminal of the middle cranial fossa. So that we have discussed in the osteology of the cranial cavity. So lateral to the sphenoid bone, I mean petrous part of the temporal bone and where it is going to fuse with the sphenoid bone. There we can identify the depression called as cavum trigeminal where it lodges the trigeminal ganglion. So this trigeminal ganglion in this picture you can identify clearly, and it is going to divide into three divisions: ophthalmic, maxillary and the mandibular. Mandibular is carrying two types of fibers, sensory and as well as the motor. Okay, the sensory root is derived from the trigeminal ganglion, and the motor root arises directly from the pons and passes below the ganglion and the sensory root. So from the middle cranial fossa, both the roots emerges through foramen ovale and immediately below the foramen unite to form the trunk of mandibular nerve. Trunk of mandibular nerve. Then what happens is it enters into the infratemporal fossa. The trunk intervenes between the tensor valley palatini medially and the laterally we can identify lateral pterygoid muscle laterally. So the otic ganglion is sandwiched between the nerve trunk and the tensor palatini muscle, and the middle meningeal artery lies behind the trunk. And after a short course, the trunk divides into a small anterior division and a large posterior division. So let us discover this is about the brief introduction of the mandibular nerve, the two roots of the mandibular nerve. Now, what are the branches coming from the trunk of the mandibular nerve? So from the trunk of the mandibular nerve, we can identify two branches are arising. One is the meningeal branch and nerve to medial pterygoid. First, let me explain you about this nerve to medial pterygoid. So nerve to medial pterygoid is a small branch which supplies the medial pterygoid from the deep surface and provides a few filaments which pass through the otic ganglion, and without interruption it supplies the tensor tympani and the tensor valley palatini muscle. So this is about nerve to medial pterygoid. So first branch is nerve to medial pterygoid, and second branch is nervus spinosus. It is also called as meningeal branch. So it enters the skull through foramen spinosum along with the middle meningeal artery and supplies the dura mater of middle cranial fossa. So it is a schematic diagram. You can remember easily. You take a pen and try to copy the diagram, and you follow this. What are the which branches are sensory, which branches are motor? I will explain. Okay. So from the trunk, two branches. One is nervus spinosus and nerve to medial pterygoid. Nerve to medial pterygoid, it supplies to the medial pterygoid, tensor tympani, tensor palatini muscles. Then nervus spinosus, which is passing through the foramen spinosum and enters into the middle cranial fossa and supplies to the dura. That is about the trunk. Now coming to the anterior division of mandibular nerve. So from the anterior division, we can identify it gives of three branches, three motor branches and one sensory branch. So the three motor branches are: one is masseteric nerve. So this masseteric nerve passes laterally, as we have seen the masseteric branch of the maxillary artery. It is running along with the masseteric branch of the maxillary artery, and then it is running above the lateral pterygoid, behind the tendon of temporalis and in front of the temporomandibular joint, and nerve emerges through mandibular notch, and then it is running outside and supplies to the deep surface of masseter muscle. That is about masseter. It is a motor branch. Next one is the deep temporal nerves. A pair of deep temporal nerves. A pair of deep temporal nerves. Usually, they ascends upward deep to the upper border of the lateral pterygoid, and then it enters the deep surface of the temporalis and supply to the temporalis muscle. Then comes to the nerve to lateral pterygoid. It enters the deep surface of the muscle and supplied to the lateral pterygoid from the medial aspect or deeper aspect. Then last one is the buccal. So it is a sensory nerve. So only one sensory branch. It is from the anterior division. It emerges between the two heads of lateral pterygoid muscle and then passes downward and forward and appears on the cheek beneath the anterior border of the masseter. The nerve supplies the skin and the mucous membrane of the cheek, related to the buccinator, but not the buccinator muscle. So the buccal branch, it is not supplying to the buccinator muscle. It supplies to the cheek related to the buccinator. Okay, and the mucous membrane of the cheek, that is supplied by the buccal branch of the anterior division of the mandibular nerve. Okay, here in this image, I'm just showing you all the branches, deep temporal nerves, then you can identify the lateral pterygoid, then you can identify this buccal branch. Then coming to the posterior division. Posterior division, it gives off three sensory branches. One is auriculotemporal nerve. So here you can see that auriculotemporal nerve, how it is surrounding or encircling the middle meningeal artery. The two roots of auriculotemporal nerve embraces the middle meningeal artery. Okay, it usually arises by the two roots which encircles the middle meningeal artery. The roots then unite to form a single trunk. Then it passes backward under the cover of lateral pterygoid between the neck of the mandible, and then it is running upwards. The sputum, it is passing between the mandible and the sphenomandibular ligament and lies above the first part of the maxillary artery. The nerve then turns laterally behind the temporomandibular joint, close to the upper part of parotid gland. So remember, auriculotemporal nerve, which is running upwards. It is having two roots. The two roots embraces the middle meningeal artery. So this provides the branches. One is auricular branch, then superficial temporal branches, articular branch, and inferior alveolar branch. Okay, so these are the branches coming from the posterior division. Okay, so from the posterior division, one is auriculotemporal nerve, then you can identify inferior alveolar. These are also three sensory nerves. Okay, inferior alveolar, it is also called as dental nerve. So both sensory and motor fibers, they conveys, then emerges under the cover of lower border of lateral pterygoid, passes downward, forward between the ramus of mandible and the sphenomandibular ligament, and enters into the mandibular foramen along with the inferior alveolar artery, which is a branch of the first part of the maxillary artery. Okay, so that is about the auriculotemporal nerve and the inferior alveolar nerve. And last one is the lingual nerve. So the lingual nerve, it lies in front of the inferior alveolar nerve between the lateral pterygoid and the tensor veli palatine muscle and receives the Caudatympani nerve from behind at an acute angle. The nerve emerges from the lower border of lateral pterygoid muscle. Remember, these are the three sensory branches: lingual, auriculotemporal, and the inferior alveolar nerve. So when you are writing the course of these nerves, write very briefly in the examinations that the two roots, they two roots embraces the middle meningeal artery. That is about auriculotemporal nerve. Then this auriculotemporal nerve ascends upwards and supplies to the TMJ, temporomandibular joint, and superficial temporal branches supply the skin of the temple. Then articular branch, auricular branch supplies to the ear, anterior external acoustic meatus, and the anterior wall of external acoustic meatus. They are all supplied by these auricular branches. Okay, so that is about the branches of auriculotemporal nerve. Okay, that is about the three branches of the posterior division. Here you can identify auriculotemporal nerve. Then you can see how it is extending upwards. This is parotid branches coming from the auriculotemporal. This is articular branch. Then you can identify the superficial temporal branch, and these are the auricular branches. These, remember these four branches regarding the auriculotemporal nerve. Then coming to the inferior alveolar nerve. So inferior alveolar, it conveys, as I said earlier, conveys both sensory and as well as the motor. Then it is running down and enters into the mandibular foramen along with the inferior alveolar artery. Then it is passing in the mandibular canal and divides into the incisive and the mental branches. So here you can identify this nerve to the mylohyoid. Before it enters into the mandibular foramen, it gives a branch called as nerve to mylohyoid. Then it is enters into the mandibular canal. In this image, you can identify clearly how it is entering into the mandibular canal. And it is going to divide into incisive and mental branches. Mental branch, which is coming outside through the mental foramen and supplies to the muscles attached to the external surface of the body of the mandible. And this is mental branch. And then coming to the caudatympani. Before going to discuss about this caudatympani, I already explained you about this nerve to mylohyoid. Before the inferior alveolar nerve enters into the mandibular foramen, it gives a branch to mylohyoid muscle. That is the nerve to mylohyoid muscle. Okay. Then coming to the lingual nerve, it lies, yes, coming to the lingual nerve. So it lies in front of the inferior alveolar nerve between the lateral pterygoid and the tensor veli palatini muscle and receives the caudatympani. So here you can identify posteriorly lingual nerve is receiving the branch from the caudatympani. It communicates with the caudatympani. The nerve emerges from the lower border of lateral pterygoid and passes downward and forward between the ramus of mandible and the medial pterygoid muscle, then comes in direct contact with the mandible, medial to the third molar tooth, and intervenes between the origins of superior pharyngeal constrictor and the mylohyoid muscle. So this supplies to the anterior two-thirds. Lingual nerve, it supplies to anterior two-thirds of the tongue. Then coming to the distribution, it provides the nerve of general sense of the pre-sulcal part, means anterior two-thirds part. General sense is carried out by this lingual nerve. And the floor of the mouth and mandibular gums also supplied by this lingual nerve. Special visceral afferent means anterior two-thirds afferent fibers, general sense carried out by this lingual nerve. Is also supplied to the submandibular ganglion and the and also to the buccal gums of the lower jaw. Communications. With which structures it is communicating? It communicates with the caudatympani. Here you can identify it is also communicating with the submandibular ganglion, sublingual gland, then it is also communicating with the hypoglossal nerve. And this it is the function is carried out by this is the proprioceptive sense from the tongue, hypoglossal nerve communication. Then coming to the caudatympani nerve. Caudatympani, it is a branch of the facial nerve. So here you can identify the caudatympani. Caudatympani is a branch of the facial nerve, means seventh cranial nerve. It conveys the preganglionic secretomotor fibers to the submandibular and the sublingual glands and taste fibers from the anterior two-thirds of the tongue except valate papillae. Okay, so and then this caudatympani arises from the facial nerve about 6 mm above the stylomastoid foramen. Above the stylomastoid foramen, you can identify the stylomastoid foramen over here. So just above the stylomastoid foramen, 6 mm above, this caudatympani is arising. It is extending outside. It is passing through the tympanic membrane between its mucus and the fibrous layers and junctions of the pars flaccida and pars tensa. The nerve enters to the infratemporal fossa through the medial end of petrotympanic fissure, then passes downward and forward under the cover of lateral pterygoid, crosses the medial side of the spine of the sphenoid bone, and joins with the posterior border of lingual nerve. So you can identify clearly how it is joining with the lingual nerve. So this caudatympani, what does it do? It provides a communicating branch to the otic ganglion, which probably forms an alternate route of the taste sensation from the tongue. So that is about the caudatympani nerve. Okay, mandibular nerve and its branches we have discussed. Then caudatympani and lingual nerve also we have discussed. Thank you, students.